From our 22 News Broadcast Center, this is 22 News in Focus.
Good afternoon and welcome to 22 News in Focus. I'm Nick Oresco. Massachusetts and the rest of the country has been dealing with an epidemic of opioid addiction and overdose deaths. Thousands of people across the state have died as a result, but the state's Department of Health has recently released a report showing a decline in opioid-related overdose deaths. Joining me now to discuss the issues surrounding addiction in our region is Dr. Robert Roos, president of Mercy Medical Center and Johnson Memorial Hospital. Thank you, Robert, for being on our program today.
Thank you. It's my pleasure.
All right, so let's get right into it. Some background information on this opioid crisis that continues, of course, not only across the country, but here in our state. If you can define for us, what is an addiction?
Sure, and thank you for having me. And as an addiction medicine provider, and also as a president of a hospital system, it's of great concern to me that we're still talking about this epidemic. It's my responsibility to help create environments of care, to create healing. And the fact that still so many people are struggling with addiction is something our community continues to need to pay attention to. Addiction itself can be defined as a chronic disease, one that impacts people's sense of reward or euphoria or pleasure when they engage in a behavior or use a substance. Their dysfunction around motivation or drive, as well as memory. And the dysfunctions in the brain that occur in those different pathways can lead to compulsive use, either of a behavior or a substance that can lead to problems both in their personal lives and in their social lives. And that's really how we categorize addiction.
Of course, it's not just physical, as you mentioned. It can also be psychological as well.
Absolutely. We really categorize addiction as a biological, psychological, social, and spiritual illness. It's something that has manifestations that impact people in a variety of ways.
You turn on the news and you usually will hear something about the opioid crisis continuing. How did this opioid addiction become a national crisis?
So there's quite a history to this one, and I will comment and say that in many communities and in many areas, addiction, whether it's alcohol, cocaine, heroin, or others, they've been problems for a long time, and they are deeply rooted. What caused the national crisis of opiate addiction around 10 years ago was the sudden and dramatic increase in overdose deaths that was occurring. What precipitated that and preceded it was an overprescribing of opioids for the treatment of pain that led to millions of people being exposed to substances that have a high potential for compulsive use, and in a setting where we have high rates of trauma, isolation, loneliness, and other factors that can lead people to be at risk, we are grappling with one of the most serious crises of our time.
There are a lot of drugs and or substances that can cause addiction. You named a few. A big one, though, especially recently, is fentanyl, and that is causing a lot of deaths, overdose deaths right now. What is fentanyl and why is it so dangerous?
So fentanyl is a synthetic or a man-made opioid that can be prescribed for the purposes of treating pain. The reason why it creates such risk with overdose is that it is incredibly potent. And so when prescribed for individuals for the purposes of pain treatment, it's prescribed in microgram doses. When it's adulterated and put into an illicit drug supply, it has a potency of about 100 times that of morphine. So it creates great risk for the user who may not realize it's as potent as they're intending and can then create severe risk for an overdose or a fatal overdose.
And it doesn't take much either. I mean, even if you are around a little bit, that can cause some major damage.
It could, in that it's so potent that if you have it in any significant quantities or your tolerance to that substance is low, it can lead to a depression in your rate of breathing and therefore can cause a risk for death.
We are more than 4 years since the onset of COVID-19. How did COVID-19 play a role in this epidemic that we are dealing with?
Well, we saw the dramatic rise in fatal overdoses occurring from about 2000 till about 2016, and then we saw a plateau far higher than it ever should have been. But then what happened with COVID and the pandemic is we saw another increase in overdoses and overdose deaths, really driven by what was caused by social isolation, the lack of people engaging in ways to support their recovery, barriers to access to treatment, and so it created another set of risk factors that created a real concern for people with addiction and caused more deaths than we would have otherwise anticipated.
One of the surrounding issues, treatment. It is treatment, the lack of treatment across not only, of course, the country, but as well as our area as well. In the demand of beds as well. What's being done locally here in Western Massachusetts, or even as a whole in the state of Massachusetts, to increase treatment beds?
So one of the most important things about treating opiate addiction is that there is evidence-based practices that involve the use of medications to treat opioid addiction that have been shown to reduce the rates of death and increase the rates of recovery. I would change the conversation a little bit. It's not so much about beds. Beds can provide inpatient treatment for those at highest risk of severe withdrawal symptoms when they may be coming off of alcohol or opiates. But really what people need is long-term treatment in outpatient settings that's connected to recovery supports to support that for the long term.
Go ahead.
And there's been, I would say, there are incredible efforts across the Commonwealth in expanding access to treatment. So outpatient settings now engaging people with lower barriers to treatment, keeping and retaining patients on the long term on medications like methadone and buprenorphine. Those are really the life-saving interventions. And the better that we stitch together an integrated system of care, the better we will see the outcomes and the lower the rates of overdose.
Yeah, we want to see that trend continue, obviously. What are the most common types of treatment available for those seeking recovery?
So there's a wide variety of treatment options, and I think one of the main principles of recovery is that not one path is right for everybody. With opiate addiction in particular, because of the strong physical component, a combined treatment with medications and some form of other support, whether it's psychosocial counseling, recovery support, or connection to something larger, sense of meaning, really has the best outcomes, reducing death and keeping people engaged.
All right, when we come back, we'll be discussing a funding boost for Mercy Medical Center's addiction consult services. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Our guest today is Dr. Robert Roos, president of Mercy Medical Center and Johnson Memorial Hospital. Mercy Medical Center recently received grant funding from the state to support the hospital's substance use disorder consult services. Let's bring the doctor back in now. So why was this hospital chosen for this award, and how much will the hospital be receiving?
So I will just say we are so grateful for this grant from the Department of Public Health. Mercy Medical Center's mission is to be a transforming and healing presence in our community. I believe one of the reasons why we were selected for this grant to support these services is because of the innovative work that we've been doing over the last decade to attend to all the needs of our community and our patients. We take a holistic approach. We take one that is oriented on wellness and creating that space for anybody to be able to attend to the needs that matter to them most. In 2016, I had a vision to create a service that would be able to treat patients with substance use disorders that were coming into the hospital for any reason. They're showing up in the emergency department with a broken arm or admitted to the hospital with pneumonia. But as they were there, if they had a co-occurring substance use disorder, a problem with alcohol, a problem with opiates, or some other condition, we would have a team that, just like any medical condition, would be able to intervene, evaluate fully, and then initiate treatment or refer out elsewhere for ongoing care. Us having that system in place, which is an evidence-based model, the state looked to that and said, Mercy's been doing it. We want to make sure it's sustainable, and they're bringing in other collaborations along the way. So we were awarded a little over $1 million to continue that program for this year, with options of about the same over the next 7 years total. So we're very fortunate and appreciative of that collaboration and work.
And that program is called the Addiction Consult Services Program. If somebody is looking for help and is interested in that program, how can they get involved?
Yeah, so I think about this in a few ways. You know, the program itself is not a treatment program that people would come to the hospital for. It's a way to evaluate and treat patients that come to the hospital for other reasons that we can then deploy a consult team to help assess and then connect them to care and initiate treatment for those people that are there that need it then. It also is an opportunity for us to collaborate with agencies in the community that provide harm reduction services, that provide education, that provide naloxone for overdose prevention, and that can provide recovery coaching inside and outside of the walls of the hospital. And so we're fortunate to be able to meet those needs of any patient that walk through our doors.
That vision has been around for a long time, the program as well. How has it been going those years that you've been offering it?
Yeah, I will say under the leadership of some tremendous people, Dr. Edna Rodriguez, Dr. Ari Kriegsman, who have really spearheaded an evidence-based model. We've seen increases in engagement of our patients. We've seen more patients stay in the hospital to complete their treatment. We've seen less patients relapse, so they stay into treatment longer after they're referred. And ultimately, we would believe that leads to less relapse, less death, and improvement in all health outcomes for those patients.
Is there a team that creates a treatment program, and what would that involve?
There is. That team that can provide those consultation services includes an addiction medicine trained physician and physician assistant, as well as licensed clinical social workers with the input of other behavioral health specialists, psychologists, and recovery coaches, which is a key element that will follow them outside the hospital walls as well.
And I'm going to assume it depends on the person for how long they are in that program for?
So we'll provide those services while they're treated a different condition in the hospital, and then our goal will be to connect them to longer term care after they are discharged. And that could happen in a variety of different community-based organizations.
Yeah, what does that aftercare look like?
Well, it can look like, for different people, different things based on their condition. For somebody with opiate addiction, it often looks like connections to treatment with medication and counseling. It can also look like connections to recovery support, 12-step help, step help, or other pathways for longer-term care if somebody needs support with housing or other resources.
What types of opioid prevention strategies are involved, or do you involve?
We're fortunate to partner with an organization called Tapestry Health locally in the area. They're the leaders in harm reduction services. Part of this grant-funded program will bring their services into the hospital to not only provide education, but also provide harm reduction tools, kits, and naloxone for individuals that might be at risk of overdose.
Have you been working with them from the onset?
That will be a new, engagement. We've always collaborated with them, but this funding will allow some additional support for some additional resources and education to happen within Mercy Medical Center.
Opposed from Tapestry, any other community partners that are involved?
I'd like to highlight Gandara, who also is an excellent expert in this area, delivering culturally sensitive, culturally competent, and linguistic care. And they've been long leaders in this space. And we partner with them to provide recovery coach services that can meet the needs of the patients that we're treating.
Is community outreach or public messaging a part of this program, and what does that look like?
It is, in the sense that Mercy Medical Center, through some of this funding and our partnerships with other community organizations, continues to be engaged in other task forces, like the Hampden County Addiction Task Force, and other ways that we can contribute to educate the community and ensure that people have the services and supports that they need.
So we are in 2024 again, more than 4 years since the onset of COVID-19 back in 2019, 2020. Any difference between the onset of COVID to now? Any changes for the better, for the worse?
In regards to the opiate addiction
Yes.
epidemic? What I'll say is what we've seen is a reduction in fatal overdoses in the last year that has us more in line with where we were pre-pandemic.
Okay.
What the pandemic taught us many things. You and I know this. We talked about this a lot.
Yes, we did.
One of the things I think it reinforced for us is the power and value in people connecting with each other. And when those connections are disrupted, it can lead to isolation, it can lead to loneliness, and it can lead to disruptions in how people access services that can attend to their health and well-being. And now that we are emerging from that and have emerged from that in different ways, I think we're seeing the benefits of that in our investments, ensuring that people are connected to the things that can make them stay well.
A lot of great information. After the break, we'll discuss a new report issued by the Massachusetts Department of Public Health on opioid-related deaths right here in the state of Massachusetts. You're watching 22 News in Focus. We're back now with 22 News in Focus and Dr. Robert Roos talking about substance abuse treatment and prevention. The Massachusetts Department of Public Health released a report this month on opioid-related overdose deaths. They found that deaths decreased by 10% in 2023, the largest decline in 13 years. Some good news there. Data from the first 3 months of this year show that opioid-related overdose deaths continue to drop. Again, we're on the right trend here. What does this report signal to you?
To me, this report shows some positive momentum. However, it also tells me we have a lot more work to do. To put that in context just a little bit, if we went back 20 years, in the Commonwealth of Massachusetts, there were about 500 people dying of an opiate overdose. Those rates quadrupled, so that around 2014, we were up at around 2,000. It then increased around the pandemic to about 2,300, and now we've seen a slight decrease. So we still have far too many people dying of an opiate overdose. While we've seen the trend go in the right direction over the last 18 months, and there's a lot of reasons for that, which are very good, we still have a long way to go.
Right, one is way too many. Why are we seeing a decrease? You mentioned there are a lot of reasons. Anything in particular that stands out to you?
The single most important reason, I think, is that we are lowering barriers to access to treatment with medications. Medications like methadone and buprenorphine and naltrexone save people's lives that are dealing with opiate addiction. And the more ways that we create easy access for people to gain treatment, the better that we will see them stay in treatment, reduce those thresholds. That's a complex topic because we have to reach into different communities in different ways. We have to tend to different needs of different people. But essentially, it's making a treatment more accessible and introducing harm reduction principles in the naloxone across the board to make it commonplace so that people aren't at risk of dying if they are to suffer an overdose.
This data, of course, coming from the state, pretty large state of Massachusetts. Are we seeing the same trend here in Western Massachusetts?
Actually, to some degree, not quite the same way. If we look at it specifically county by county, from last year to this year, Hampden County was flat. We actually saw increases in overdose deaths in Berkshire and Franklin County, while we saw more significant decreases in Hampshire. So it's a mixed picture. And there are some communities right now that are seeing the effects in a disproportionate way compared to others. And I think this report also signals we need to pay attention to that in new and different ways.
Those numbers you mentioned, Franklin, Berkshire County, those are more rural areas than Hampden County.
That's right.
Any particular reason of why those numbers are increasing compared to cities like Springfield or at least Hampden County?
So about when the pandemic started, we saw this lines cross where previously urban centers had the highest rates of overdose deaths compared to a population number. Around 2019 and 2020, the most rural communities in the Commonwealth we saw that line increase such that they became the communities that now had the highest rate of overdose death per capita. What I think that was related to is that the communities where people are the most isolated, particularly around the time of the pandemic and now after, creates this concern where we know that using alone puts people at higher risk of death. People isolated in more rural areas may not have access to treatment in the same way as those in urban areas. And there may be different confluences of factors like social housing concerns, isolation, mixing with other substances that can put those communities at risk. And we need to focus on those in new ways that can help reach people that are in need.
Are you seeing any specific demographic who is struggling the most with addictions?
So when we look at it by rural and urban, certainly those most rural communities are struggling more than the urban communities or the suburban communities. Importantly, in this report, it shows that while the overall overdose death rate declined, we saw increases disproportionately in overdose deaths amongst Black and Hispanics. And so what it also is really important, I think, for everyone to recognize is that different communities may need different strategies, and the investments need to be made to be able to address and intervene so that everybody has equal access to treatment and is able to see the same sorts of decreases as others.
Something that is becoming more recognizable is Narcan. A lot more people, in my opinion, I think, are using Narcan. How important is it for when somebody is suffering from an overdose?
It's essential. Naloxone, commonly referred to as Narcan, being an opiate antagonist, can reverse a fatal opioid overdose. It's the type of medication that I believe should be commonplace in every public setting. Anyone who may encounter somebody who's at risk of using an opiate should carry it on their person or in their car or in a place that they could utilize it. It's a life-saving intervention that has saved countless lives, and we know that it's saving some now. And so more availability, move towards over-the-counter, move towards being able to leave hospitals and clinics and other settings with naloxone in your hand has the real potential to save someone else's life or your own.
And we're seeing a lot more officials carry it as well, fire departments, police departments, officers, which is obviously good to see.
It sure is.
What are some ways a person in recovery can keep themselves from relapsing?
So when we think about addiction, we recognize that part of the disease may come with periods of relapse and remission. Just like any chronic disease, whether it's diabetes or asthma, addiction is similar, so relapse can occur. Just like when treatment of any medical condition, there should be a structured plan that helps somebody protect them against relapse. And that can include medications, psychosocial lifestyle interventions, and I think in the case of substance use disorders, connections to recovery support, a community that's helping support you maintain some of those decisions to protect yourself.
And if someone is struggling right now, what do you recommend they do?
Well, certainly there are treatment centers that are open and accessible, and I would encourage you, if you're in a moment in your life and you realize you may have a problem with a substance use disorder, or you may have a substance use disorder or a problem with using substances, to reach out for help. There is a statewide helpline that can be used. You can text HOPE to 800-327. You can call 800-327-5050 at anywhere in the Commonwealth, and you or a family member can get some support on where the closest treatment facility might be that you have access to that could meet your needs.
All right, we'll have some final remarks when we come back. You've been watching 22 News in Focus. Today we've been discussing the issues surrounding addiction in our region with Dr. Robert Roos, president of Mercy Medical Center and Johnson Memorial Hospital. We're talking about addiction. Any final thoughts, remarks about this ongoing crisis across our country?
Substance use disorders continue to be one of the leading causes of preventable death. They impact everybody. But I do want to make the point that recovery is real. Addiction treatment saves lives, and if anyone is struggling at home or a family member is struggling, there is help available. A number across the Commonwealth of Massachusetts that can be called is 800-327-5050 or text HOPE to 800-327.
All right, Doctor, thank you for joining us, and thank you for watching. If you missed any of the program, you can log on to our website, wwlp.com. From all of us here at 22 News, enjoy the rest of your Sunday.